Hi everyone. So in this video, I'm going to talk about cytolytic reaction to leukocytes, which is also called agranulocytosis. So in this kind of reaction, the antibodies which are developed against the polymorphonuclear leukocytes, that is neutrophils, can lead to the destruction of these neutrophils, and which cause neutropenia or agranulocytosis. Okay, so uh, under this these types of disease, basically in this video I'll talk about three diseases: autoimmune neutropenia, AIN, neonatal leukopenia, and drug-induced agranulocytosis. Okay, so first let's talk about autoimmune neutropenia. Okay, so in this case, autoantibodies against own body neutrophils are formed, and basically there are two types. One is primary AIN and secondary AIN. In case of primary AIN, it is usually seen in children under 3 years. Okay, and the secondary AIN, it mainly occurs in the adults between around 40 to 60 years old aged people. Okay, and the secondary AIN is associated with autoimmune thrombocytopenia lymphoma. So how we can diagnose autoimmune neutropenia? Okay, so by detecting the autoantibodies, and autoantibodies can be detected by agglutination test or immunofluorescence. Also, the white blood cell count and neutrophil count should be checked. Okay, and how to treat autoimmune neutropenia? Usually, spontaneous remission occurs. I mean, people usually get well by their own, but antibiotics, steroids, and sometimes growth factors, which are hematopoietic growth factors, are used as treatment to treat autoimmune neutropenia. Okay, so now another type of disease, neonatal leukopenia. So from the name, you can actually see. I mean, this leukopenia happens to the children. So what happens here? The mother produces antibodies against fetal leukocytes antigen. Okay, and this antibody then cross the placenta and neutralize the white blood cell of the neonates. Okay, and the neutrophil associated antigens which cause neonatal leukopenia are pleomorphic. That means these antigens, they don't have any rigid or exact size and shape. And so far, at least 8 this type of pleomorphic antigens have been identified, and antigens which are associated with neonatal leukopenia are Na1 and Na2, located on the Fc receptor of the neutrophil. Okay, and the mothers of this infant do not have granulocytes with Fc gamma R3, and the treatment for neonatal leukemia is usually growth factors. GCSF are used to treat neonatal leukopenia. The third disease was drug-induced neutropenia. So, if you can remember, drug-induced hemolysis can occur, right? So, similarly, there are some drugs such as sulfapyridine and aminopyridine. These drugs, they may adhere to white blood cell and then function as hapten. So, and the consequence is the destruction of white blood cells, and the decreased ability to defend against infection. Okay. However, sometimes drugs may have direct non-immune cytotoxic effect. I mean, that sometimes drug can affect or destroy the white blood cell through immunogenic or immune reaction. But sometimes some drugs, they can cause the cytotoxic effect directly. Okay, in a non-immune manner. Okay, and some case of agranulocytosis are caused by a congenital metabolic defect. I mean, some people, they may have a congenital. I mean, the problem they get by birth. This congenital metabolic defect can also cause agranulocytosis. Okay, and also sometimes in non-immune cases, more than one line of leukocyte is involved. Okay, and all leukocytes containing granules are destroyed or fail to develop. Okay, antibodies to leukocytes are also found in some disease cases, like for example AIDS. Okay, AIDS patient, they may also have antibodies. Okay, and the treatment towards this drug-induced neutropenia is growth factor, such as GM-CSF. It's a growth factor. Okay, so usually the growth factors, they induce the proliferation of the cells of our body. Okay, so that was all for the cytolytic reaction to leukocytes. Now I'll talk about the cytolytic reaction to another blood cells, which is platelets. Okay, so immune reaction can platelets can occur, and it can destruct the platelets. So what will be the result? The results will be formation of purpura and other hemorrhagic manifestations. Hemorrhagic means, right, blood hemorrhage. Okay, so as we know that platelets are responsible to prevent blood hemorrhage in our body. I mean, due to accident or sometimes our blood vessels can get damaged, right? If our blood vessels get damaged, hemorrhage, leaking of the blood can occur. But the platelets of our body, they prevent this. Whenever our blood vessels get damaged, platelets clot that and seal that, so no hemorrhage can occur. But if someone have, in someone body, cytolytic reaction to platelets occurring, the platelets get destructed. So that's why if some damage in the blood vessels occurs, as there is a low number of platelets, they cannot efficiently seal the damage. Okay, so it will result in blood hemorrhage. Okay, so and if blood leaks, they look like this. Okay, the the red spot in the skin. This is called purpura. Okay, and related disease. These are some example of the cytolytic reaction to platelets diseases, such as post-transfusion thrombocytopenia purpura, neonatal autoimmune thrombocytopenia, idiopathic thrombocytopenic purpura, and quinidine purpura, drug-induced purpura. Okay, so in the next slides, I'll talk about this these diseases. Okay? So first, post-transfusion thrombocytopenia purpura. In which case it occurs. This uh, can occur as a result of production of alloantibodies after transfusion of blood containing allogenic platelets, and the cause of destruction is unclear. Okay, so suppose it can happen that after the blood transfusion, the recipient one, they can produce or induce antibodies against the donor's platelets. Okay, and it can cause the cytolytic reaction towards those incoming platelets and cause destruction of the platelets. Okay. However, reaction of this type is seen only in women who have been pregnant. Okay, and sensitization may originally occur to platelet antigen from fetus. Okay, so how we can diagnose post-transfusion thrombocytopenic purpura? We can use antibodies. Antibodies to the platelet antigen P1A1 are invariably found. Okay, others antigens are rarely found. This is very common. This antibody is very common, so we can use antibodies against this one. Okay, and the treatment is plasma exchange. Okay, you have to just change the plasma. Then neonatal autoimmune thrombocytopenia, NAIT, and it occurs. How it occurs? Occurs when maternal immunoglobulin G antibody, okay, that is the mother's antibody, crosses the placenta to the fetal platelet antigens, okay, contributed by father. Okay, so that neonatal autoimmune thrombocytopenia. But from the name, we can actually guess that this reaction occurs in the neonates, that is the placenta. So definitely the antibody will comes from the mother. Okay, and associated antigen which are responsible for this reactions is P1A1. Okay, 50 to 90%. In a 50 to 90% cases, P1A1, this is responsible. This antigen is responsible for this reactions. Also, some 5 others antigen also have been reported. Okay, and This disease is similar to erythroblastosis fetalis, and although uncommon, bleeding may severe. Okay, with intracranial hemorrhage and permanent neurological damage. Okay, I mean it can cause uh, unstoppable bleeding, very severe bleeding, which may cause some permanent damage in the neonate's neuron. Okay, and the treatment is platelet transfusion. I mean, if the platelets goes very, I mean, we know this kind of reaction, okay, in thrombocytopenia, the numbers of platelets goes down because of the destruction of them. So if the platelets count is very low, then we have to give them platelet. That is, we have to transfuse platelet. Okay, by this, this type of situation can be treated. Okay. So the final one, idiopathic thrombocytopenic purpura. Okay, and these diseases, I mean, these reactions are usually is associated with viral infection. For example, rubella infection, and uh, the platelets they get destructed because antigens of infectious agent adherent to platelets and the antibodies to altered platelets due to infection and antigen antibody complexes adsorbed to platelets. I mean, actually, these are not the steps. These are three different mechanisms by which the platelets can destructed under idiopathic thrombocytopenic purpura. Okay, and there are two forms of ITP. One is acute form, which is common in child, then in adults. I mean, acute form is very common in children, not in the adult. And the chronic form, and chronic form is common for adults, and it occurs because of autoantibodies to normal or altered platelets. And chronic form is also associated with SLE or lymphoproliferative disorder such as leukemia. And okay, and how we can treat the idiopathic thrombocytopenic purpura by using steroids or antibiotic against infection, because as this reaction occurs because of infections, so we can use antibiotics or antimicrobial agent. So if we can kill the antimicrobial agent, then eventually this disease will get treated. Okay, so that was all about the cytolytic reactions that occurs against the different blood cells like red blood cells, white blood cells, and platelets. So finally, I just want to talk briefly about the detection method. Okay, so like if we can detect that the cytotoxic antibodies are circulating in our blood, okay, then we can we can, I mean, if we can detect the circulating cytotoxic antibodies, then we can take decision, right? Whether we're going to do any transfusion or not. Basically, this kind of test is necessary, okay, right, before we do any treatment or do any blood transfusion. Because if the cytotoxic antibodies are present in the recipient body, so if we do transfusion, it will cause cytolytic reaction and eventually the destruction of the blood cells. So we can detect circulatory cytotoxic antibodies by doing two type of tests. One is in vivo test, another is in vitro test. We know in vivo and in vitro. In vivo means inside the body, okay, and in vitro test is outside the body, that we do usually in the laboratory, in the petri dish or slides, whatever. Okay, so in case of in vivo test to detect circulating cytotoxic antibodies, serum containing antibodies passively transferred to the recipient. We collect the serum which contain antibody, okay, and then we inject this serum into the recipient. Okay, so if these antibodies cause cellular destruction, I mean if there is antibodies circulating, cytotoxic antibodies circulating in the recipient body, I mean this serum which contain the antibody, they will react with those circulatory antibodies and cause cellular destruction. Okay, for example, platelet destruction, a specific cytopenia may develop. Okay, so this was in vivo test. So finally the in vitro test. In vitro test means we do it outside the body. So the in vitro test, there are two types. One is direct comb test, another is indirect comb test. So usually direct comb test is used for the person who for whom already the cytotoxic or cytolytic reaction is occurring, right? So what we do in the direct comb test, basically we collect the blood from that person who already is suffering from some cytolytic reactions and use a antibody. Okay, because if a person is suffering from some cytolytic reactions, basically their blood cells, they are sensitized with some circulating antibody, right? They are sensitized with cytolytic antibodies. So we just collect those blood cells from that person and use an antibody which can bind with this circulatory cytolytic antibodies, and if it bind with it, then blood clot or agglutination will occur. Okay, so by this we can detect circulating cytolytic antibodies in a direct way. In case of indirect way, okay, basically we collect the blood cells from the persons and then we sensitize them with circulatory antibodies. Okay, so try to understand what's the basic. Basically, this test shows that whether the person's blood cells, they're prone to bind with the cytotoxic antibodies, right? If the cytotoxic antibodies bind with the blood cells, eventually the cytolytic reactions will occur. Okay, so just in an indirect, in the indirect comb test method, we just collect the blood cells from the person and then sensitize them with the cytolytic antibodies. Okay, and then finally we detect, if these blood cells get sensitized with the circulatory cytolytic antibodies, then they will bind with the test antibody. The antibody that bind with those circulatory cytolytic antibodies and will cause agglutination. Okay, so by this way we can detect the circulatory cytolytic, cytotoxic or cytolytic antibodies. Okay, so that was all for the cytotoxic and cytolytic reactions. Okay, so from the next video we'll talk about another, or we'll discuss about another immunopathology reactions. Okay, till then, be safe. See you.